Today I want to introduce the oral health care process. As the name suggests, this is a process for achieving oral health together with our patients. It's a concept or a process that you're going to learn about across the next 3 to 5 years. Everything you learn in your course should be related to the oral health care process. That is how we move individuals, groups, and even communities or populations towards better oral health. The process is systematic, it is scientific, it is evidence-based, and it's verifiable. It's something that you will develop a more sophisticated understanding of as we move through the course. But today what I want to do is just introduce the process in a basic way so that you start to get a sense of why it is we are using this process to guide the way you're learning, but also to guide your clinical practice. I want to introduce a patient of ours who came to the student clinic and presented with a mouth that looked like this. Now, you may look at this mouth and think this is not the sort of mouth that I would want myself. And some of you may also look at this mouth and say, clearly this is a person that doesn't, one, value their oral health, or two, come along to dental services. They've obviously neglected themselves and haven't attended dental services. In fact, that's not the case. This particular patient was a regular attender. They came every 12 to 18 months to an undergraduate teaching clinic. They presented each time to that clinic with new cavities, new dental decay which had occurred since the previous treatment had been provided. And in fact, for some of these restorations or fillings that have been placed in the past, around the edges of them you can see new decay occurring. So the patient was a regular attender. However, every time they attended, they had ongoing new disease and new disease in their mouth. You'll probably also notice some other things here. The gums perhaps not as great as we would like them to be. There are a number of missing teeth, so obviously those teeth have encountered some serious disease issues, which meant that they either fell out or had to be removed. Now, when we look at this mouth, the question is why, despite the fact that this person was a regular attender and did receive dental treatment, why does their mouth look like this? Well, the answer lies in this perhaps confusing and slightly controversial statement. Dental treatment does not equal health. You can have dental treatment and still not achieve health if that dental treatment is designed to focus on a symptom or a sign of a more underlying and complex process. In this case, this patient had treatment but did not achieve health. So when we look again at the mouth, we can start to see that there are some signs here, some plaque accumulation, for example, some red swollen gums that indicate that there is an underlying disease process that has not been addressed. Lots of fillings have been placed. We can see them everywhere. But around the fillings we're seeing new decay. So that's a sign that perhaps those fillings in and of themselves are not the solution to this patient's problems. Why did this happen? I think what happened with this patient was the dental practitioners that saw this patient did two things. They identified cavities. And then the next thing they did was they filled the cavities. And that sort of, in a very simplistic way, makes some sense. See cavity, fill cavity. But as I say, that didn't work for this patient. They experienced ongoing disease and disability. Why didn't this work? Because with this simple approach, you miss some key things. So here are a number of things that did not happen with this patient when they attended dental services. And I suspect these are some of the reasons why that patient's mouth looks like it does today. Nobody bothered to understand what the causes of the cavities were. They saw the cavities, they detected them, and they provided a treatment for them, a filling. But they didn't stop to say what's causing these cavities, and perhaps we should, as well as filling the teeth, look at that cause. The other thing they didn't understand, I think, with this patient was the patient's social context. This patient was a person who subscribed to natural therapies, and in fact the reason why he was experiencing so much decay was because he was using honey to treat his gum disease. So his natural therapist suggested that honey was very good for soft tissue infections, and there is some scientific evidence to support that. So his belief system meant that he was using a medication, the honey, for one problem, which was then exacerbating his dental decay. Another problem was that nobody addressed the disease process with this patient. When we asked the patient what their understanding was of the two diseases that they suffered, gum disease and dental decay, they weren't able to tell us anything about, they didn't have a clear understanding about what caused the disease. And the other thing, and this is very significant, remember the patient was presenting every year, and each time they presented for their examination or checkup, they had new decay. The fillings in their mouth were failing, they were re-decaying, and yet nobody was saying, why did these fillings not work? There was no evaluation of the care that was provided. The care was provided, but it wasn't evaluated. Did this actually work for the patient? So what we had was this situation here on this side of the screen. There was an observation, see hole, fill hole. That's problematic because it doesn't take into account all of those points that I discussed on the previous slide. So what the oral health care process does is asks you to look at a person, to look at their social context, to look at the disease process, and do more than a simple see hole, fill hole approach. So this is the oral health care process, and it's cyclical, you can see. So once a person enters the process, once a person enters the process, there is a cycle. So there are observations made. What can we see? What is the patient telling us? And that doesn't mean just what is happening to their tooth, but we're also observing other important things. We're listening to what the patient is telling us about their life. We're thinking then about all of these things and putting the pieces of the puzzle together. And only then, once we have sort of worked out what is driving this disease in this person's mouth, what are the things in their life, in their diet, in their biology, in their genetics that are driving the disease, we then plan care around each of those things. And only then do we leap into doing something. And the final stage of the healthcare process, oral healthcare process, is evaluating. So we should always be critical of what we have done in terms of our treatment and our care for patients. Did this solution that I offered the patient actually work for them? And I think that's something we don't do well enough in dentistry and oral health. So the oral health care process is a careful, it is a logical, and here, importantly, it is verifiable. We can go back through the process so that if we get to a point where we say, actually the care that I've provided doesn't seem to be helping this person, we can actually work our way back through that cycle to identify the point at which we maybe took the wrong turn, made the wrong decision, or didn't take notice of the right information. So we can actually verify our process, and if there's something wrong with it, we can go back and identify where we actually went wrong, which decision we made that wasn't actually correct. So in short, the oral health care process allows for care, dental care, that is actually useful, helpful for patients, actually makes them healthier. That's the important thing to remember. Now, why would we want to use this oral health care process? What are the benefits of using a model like this rather than the see and react type model? Well, we know that recent trends in our understanding of health tell us that health is not just the presence of disease or pathology. There are social determinants of health. So the way that we might deal with ill health is to have interventions which are designed to improve or affect a person's social context, or it could be related to their behaviour. So treating dental conditions as not just a pathology that needs to be eliminated is a more sophisticated way of looking at health. So that's one of the reasons why we've moved to this more holistic oral health care, because we actually now know that health is more than just a bug infecting a person, then getting sick and then treatment. It's much more sophisticated than that. The other thing the oral health care process allows us to do is to overcome the limitations of using only a dental diagnosis. And I'll talk a little bit more about what I mean here. So a diagnosis, strictly a medical or dental diagnosis, is the identification of pathology. But if we take the first point, it's not just the biopathological processes that we need to be aware of if we're helping people to achieve health. It needs to be so much more than that. By just using a medical dental diagnosis, we're ignoring all of those other factors, and that's not helpful for the patient. So the dental diagnosis, let's just clarify what we mean here, is a very constricted approach to defining a problem. It identifies disease, so pathology. So gum disease, for example, we would make a diagnosis. There is periodontal, advanced chronic periodontal disease. It deals usually with pathological changes or deviations in the part of the body. So the way we would make a diagnosis is to look at the gums and say, that is a deviation from what we would consider normal healthy, therefore it is a problem that needs to be resolved. If though the reason the person is experiencing those periodontal or gum diseases is because of something behavioural or something genetic, then merely treating the signs or symptoms of it is not going to be helpful. So looking at why the social or individual behavioural determinants of that disease is also very important. And the other thing about the dental diagnosis is it strictly only applies to individuals, whereas with an oral health care process we could actually identify the family or a social group or even a population as being the unit at which we could make a diagnosis. So within a family there could be some behavioural or cultural belief systems that are actually contributing to poor health in that whole family. A dental or medical diagnosis really only allows you to look at a single person, whereas in fact in that particular context it's the family dynamics that could actually be setting up the ill health. So using strictly a dental or medical diagnosis actually constricts the way we think about how we may solve people's problems. So the dental diagnosis allows us to identify disease, but what about these things? How does a dental diagnosis allow us to diagnose problems like fear of dental treatment or fear of the dentist? That is a significant contributor to poor health. We know in our population that people who are fearful of dentistry are more likely to have poor oral health. So unless we have a tool that allows us to recognise and categorise and then plan strategies to overcome fear, we're unable to deal with that. They will never present. So our treatment, our filling or our restoration isn't ever actually going to occur because we haven't diagnosed this issue. Health literacy, people's understanding of the disease process and the need to do particular things to maintain health, that's also something we need to be able to identify or diagnose. And the medical, dental, pathophysiological process does not allow us to do that. People's ability to understand and problem solve is also really important for their health. So we need to be able to have a tool that identifies those things in our patients, also their motivation, and as I said before, family functioning and culture. So let's come back to our patient again, our presentation here. What can we see that tells us that there is a problem, that this person has some issues that they would benefit from assistance with? Just take a moment to have a look at this, pause on this video, and then write down the things that you can see, just in your own words, that you can see that perhaps are indicators that there are issues here. So I've identified a few things that I'll share with you now. One, we can see the breakdown around the margins of the fillings that have been placed in the patient's mouth. So we can see new cavitation occurring. Let's just use lay terms though at the moment, because I want to keep this simple. We can see breakdown, or the surface of the tooth is cavitated around the filling margins. Some of you also may have noted that there were red, swollen, and in one case over here, I think there was quite significant bleeding. That's probably signs of a problem. But what we also, you won't see from the picture, but what we also discovered from the patient by talking to them, by listening to what they were telling us when we asked them particular key questions, they also displayed a lack of knowledge regarding the tooth decay process. As I mentioned before, they were using honey, not really understanding how that might contribute to the tooth decay process. And the other really interesting thing that we discovered when we spoke with this patient and asked them key questions was they had a fear of using dental floss. Now, you may think dental floss is not scary, but for this particular patient, because they had so many fillings in their mouth, and some of those fillings extended between the teeth where the floss should clean, they were actually fearful that if they used the floss in between their teeth, that they might actually pull out or dislodge the fillings, and they didn't want to do that. So that was a really key issue, because it meant then that the plaque wasn't being controlled between the teeth, and of course that was contributing to their periodontal disease and also to their tooth decay problems. So these are the observations that we can make of this patient. Let's have a look now at the oral healthcare process and how we might, in a simple way, apply it to this particular patient. So what we need to do with our process is observe, think, plan, do, and evaluate. And these are the questions we should be asking ourselves as we do each of these things. Oops. So let's focus firstly on the observations. So the questions we ask at this point are, what can we see, which is what we've just done, what can we see that is not quite right, that is a deviation from normal? And this is not just looking into their mouth, but it's also what can we see in the way they behave, or see in material that they present to us, their diet, for example, or their medications, that tell us that something's not quite right. And this is what we would call, in more formal terms, signs and symptoms. So this is the first thing we're doing. What can we see that is not quite right here? And making a careful note of these observations. Something else we may observe and think about is, what is causing these signs and symptoms? Why are we seeing, for example, bleeding gums or cavitation of the tooth surface? What are the things that we've asked the patient or that we've seen in their medical history that tell us or give us some clues as to why it is we're seeing these particular things? This is called the etiology, and etiology is just a posh term for the cause or the likely cause of a particular issue. Okay, so we're looking firstly at the signs and symptoms, and then we're starting to think about and observe things that tell us about what could be causing it. What are the presumptive etiological factors? So then we move into our thinking mode. And the questions we're asking ourselves here are, what is causing these signs and symptoms? Okay, so now we're putting it all together and start to think about this. Once we've got a sense of what the signs and symptoms are and what the potential causes of those things are, we can then start to give it a name. So for example, the bleeding gums, the swollen gums, the red gums, the patient reporting bad breath, tell us that potentially there's something wrong with the gums, and we may identify that the reason that that's occurring is because they are a smoker and they're not controlling their plaque effectively. And those things together may allow us then to give that particular condition a name, and we would call it in that particular case a gingivitis, for example. So we would give it a label or a diagnosis, but we would only do that once we have carefully considered the first two steps. The next areas we're looking at are thinking and planning. So once we have worked through these questions, we then want to ask ourselves, given what they're presenting with, given what is causing the problems, and having given it a label, we have actually named it and identified it as a problem. What can we do with the patient or to the patient, for them, to achieve better outcomes? What do they want themselves, and what do we think would be beneficial to them? So that particular patient was presenting with poor gums and decayed teeth. So part of our goals are about moving the patient towards better oral health. So we may want to eliminate the gum disease if that's possible, or reduce the destruction that it causes. So what are the care goals? What are the overarching goals? Now don't fall into the trap here of talking about treatment at this point. What we're talking about here is goals. What are the overarching things? We want to restore health. We want to make the patient less fearful. We want to help them achieve a better understanding of their disease and their oral health. These are all goals that we should start thinking about at this point before we plan treatment or care. What does the patient want? What is acceptable oral health for them, and what can we actually do for them as well? Once we've decided what our goals are, we can then start to move on to the next stages, which is what are we going to do, interventions, to assist the patient to move closer towards those goals. So this is where we start doing things. But just check this out, right? Observing, thinking, planning, doing. Not observing, doing. Because if we leap from here to here, we can make the mistake that many people have made with this patient in not actually understanding what was causing the problem, what the patient wanted to achieve, and then planning care that was appropriate to address both the causes and also the patient's needs. So this is where we start doing things. Okay? It's really important that we don't rush into this point, because we could do the wrong things. And then the last thing, of course, is evaluation. How do we know that we have reached the goals that, together with the patient, we have set? What things would tell us that we have actually met those goals? So one of the goals may be for this patient to achieve good or better gum health. And one of our evaluation points might be that there is no bleeding of gums on examination. So that would be a sign that we had actually improved the patient's health. So we start with the sign of problem, bleeding. We move through the process of what's causing this, probably suboptimal plaque removal, lack of interdental cleaning, and perhaps smoking. We have planned a goal, which is to achieve better gum health for the patient. We've intervened, so we might have done some treatment on the gums. We might have introduced some effective plaque control that the patient has to do at home, and we may have introduced smoking cessation. And the way we're evaluating whether we've been successful is that the gum health improves. How do we know that? Because we eliminate the signs of poor gum health, which is bleeding. So in a nutshell, that is the oral health care process. As I say, we will look more at this as we move through and develop a more sophisticated understanding. For the moment, I just want you to understand that it is a continual process that is cyclical, and that there are a number of stages where we need to do particular things, to think, to observe, to act, and to evaluate, rather than falling into the trap of seeing and reacting, because that we increasingly know does not actually lead to optimal health for our patients.